Hello. This video is about how to buy Medicare insurance and avoid the Advantage Plan scams for 2020. Hello. If you're confused about Medicare, it's because the current administration is trying to confuse you, uh, sabotage traditional Medicare, and push you into a private insurance Advantage Plan to effectively privatize Medicare. My name is Robert Messman, and I am here to dispel this confusion and help you make the best decisions in acquiring Medicare healthcare insurance. I've had Medicare insurance for 9 years and have used it through cancer treatments, back, cataract, and hernia surgeries, and other medical issues. I'm an engineer and an MBA, so I've carefully monitored my medical costs uh, and as well as what Medicare pays for services, and have been amazed at how comprehensive and non-intrusive my Medicare with Medigap Plan G is, and how Medicare allows me the freedom to choose the best care providers and eliminates worries about large or unexpected charges. Since the spring of 2018, there have been many ploys on the Medicare site to drive you away from Medigap policies or to scare you into thinking they will cost more than Advantage plans. The most blatant falsehood on the site has been the distortion of the estimated annual cost of a Medigap policy, and emails suggesting that Medicare with a Medigap policy will cost double or triple what they actually will cost, and that they will cost more than an Advantage plan. From what I can tell, generally my Medicare with a Medigap Plan G and a drug plan costs about $3,000 less than comparable Advantage plans, despite their supposedly low cost. I'll show you this deception shortly. Note, when you get ready to get into Medicare, start by enrolling in Medicare with a Medigap policy. Importantly, you can always switch to an Advantage plan after the initial enrollment period, but switching to a Medigap plan from an Advantage plan requires that you be underwritten and could result in higher premiums or a rejection if you've developed a serious medical condition in the meantime. You're going to see this video after the deadline for enrolling for Medicare insurance plans in 2020. But given the misinformation on the Medicare site and misleading advertising by Advantage plans, you should demand access to a Medigap plan as soon as possible if you were misled into selecting an Advantage plan. Do it before serious illness strikes. After being considered in great physical shape, engaging in hiking, biking, skiing, etc., I was diagnosed with bone cancer 4 years ago. After some chemotherapy, all covered by Medicare, they recommended a stem cell transplant for which private insurers normally pay over $250,000. I thought it too costly until I learned that Medicare only paid around $70,000, and all but a few $100s of supplies would be covered by my Medicare plus Supplemental Plan G, and at a top nationally recognized hospital specializing in such transplants. In gratitude after the surgery, in order to promote better health care insurance for the U.S. populace at large, I became a director and treasurer for Healthcare for All Colorado Foundation, a nonpartisan nonprofit focusing on researching and reforming our overly expensive U.S. healthcare insurance system. I have no conflicts of interest regarding healthcare, and I'm not being paid for what I say here as I guide you through the process of getting what most honest, knowledgeable experts regard as the best and most reasonably priced medical insurance plan in America. The first thing to understand about buying Medicare insurance is that you should find a policy that allows you to get the best care possible with reasonable premiums and protection against the unexpected. All the nasty things like cancer, Parkinson's, diabetes complications that occur with aging. The cheapest premiums can lead to disastrous care or costs when you're least prepared to deal with them. That's why you should get the best policies to insure against such disasters. Medicare insurance presents the first time in your life in which you can get out from under the thumb of private for-profit insurance companies who focus on making money off your health care. However, I'm sure that you have all seen the myriad of ads for Medicare Advantage plans run by for-profit insurers that sugarcoat their plans. They tout low premiums and a bunch of minor benefits, but hide some unpleasant surprises inside, like copays for anything but wellness checkups and narrow networks which can drop your preferred provider or doctor at any time, and have tricky approval processes that can cost you major dollars. Their narrow networks can mean that you have long waits for surgeries and other critical treatments. A friend of mine with an Advantage plan waited 2 painful months for an intestinal surgery after it was approved. My 2 back surgeries were done 8 days after a 24-hour approval process. Underneath their frilly benefits lurk companies who exclude doctors and practices that treat sicker patients from their network and have high copays for drugs treating more serious illness. All the money they spend on advertising, lobbying Congress, paying commissions, and endorsements to companies like AARP limit what they can spend on you and still make a nice profit. You can bet they won't let your illness get between them and their profit. Advantage plans do get to piggyback on the amazing prices that Medicare negotiates, but Congress has let them skate on sharing in the negotiating costs. Still, Advantage plans sport overhead costs 3 times that of traditional Medicare. Since 2008, they have been overbilling Medicare by about $3 billion per year and bribing Congress to fight repayment. They game the complex laws under which Medicare pays them to get more per patient than standard Medicare, despite the fact that they filter to acquire a healthier patient population. They upcode illnesses and even bill for non-existent treatments. Do you really want these cheats handling your health care? The more serious your medical needs, the less interest they have in paying for it. In reality, they are disadvantage plans. Take a quick look at a false advertising document by United Health Group. Gonna shut off this light and swing the camera around here. And let's take a look at this. So, okay, this is a flyer from United Healthcare and about their Advantage plan, comparing it to Medigap policies. And let's take a look at the middle column is Medicare with the prescription drug plan and Medigap, and the far column is the Advantage plans. Well, they all cover Part A and Part B. Those are the first 2 lines. Annual wellness visit, yep, we all get that. Prescription drug coverage, that's the 4th line down. Part D, yeah, well, when you get Medicare and a Medigap plan, you want to sign up for a $20 or $30 a month Part D plan, so you get your coverage just like they are. Probably better coverage, actually. Annual physical, they say no coverage. That's a total lie. I can go get a physical anytime I want from my doctor, pretty much. I don't ever feel inhibited about that. Routine vision and eye coverage. I can go see my eye doctor anytime I want. That's the only place I have a copay. I had a cataract surgery and I paid $40 for the eye check and then $50 for the eye scan, and then everything else was covered. And that's normally, that routine is cataract surgery per eye is normally billed at about $6,000 an eye. I only paid those 2 items, and I had to go back and see the doctor quite a few times because I had an allergic reaction to the eye drops, the preservative in the eye drops. So that line's kind of a lie. Routine hearing exam and hearing aid coverage. I can see my ear, nose, and throat doctor anytime I want. I have no copays. I don't have anything coverage for a hearing aid coverage though. So that's there's some lies there partially. The next line down is worldwide emergency coverage. It says no coverage. Baloney. I have great coverage, and I'll show you that under the Plan G. So that's a total lie. Out-of-pocket maximum protection. I have a $189 annual deductible. That's it. I don't pay any copays or anything other than the one I mentioned. So that's a total lie. Let's go down and see a couple other things that they don't mention. Narrow network. Am I stuck in a narrow network? No, but I am with an Advantage plan. Copays for many items. No, I don't have any copays other than the ones I mentioned. I go years without having a copay. I can go to most doctors without my wallet if I've already provided them with my insurance information. But you got copays all over the place with Advantage plans. Let's try a couple other things. Tricky pre-approval process. No, I don't have any of those. Medicare approves things in 24 hours. Yes, you do have those with Advantage plan. Freedom to choose any doctor or hospital or clinic that I want. Yes, I have total freedom. Nope, you're stuck in a narrow network with an Advantage plan. Fraudulently upcoding treatment to overbill Medicare. That doesn't happen with Medicare plus a Medigap plan, but it does happen with these Advantage plans. So you can see some of the distortions in their advertising. Get this set up here again. Sorry about that. I'm a director, writer, photographer, cinematographer, everything here, so gotta kind of bear with me. Okay. Since the spring of 2018, Trump appointees Seema Verma, Medicare's chief administrator, and the current 4 Trump-appointed Medicare trustees have waged a misinformation war of fraud, misdirection, and deception against traditional Medicare on the Medicare.gov site, trying to drive you into the clutches of for-profit private insurers. I met with aides to both Senators Michael Bennet and Cory Gardner, presented screenshots of the ever-changing tricks, lies, and deceptions on the Medicare that the Medicare management has used to drive people away from traditional Medicare and Medigap policies with blatantly false information. They've taken no action because they're controlled and silenced by big donations from the insurance lobby. Most of Congress, like Minnesota Senator Amy Klobuchar, has been bought off by the giant Minnesota-based United Health Group and other special interests to hide this conflict of interest, and they hide this conflict of interest. Medicare does little advertising, so this gives a huge marketing advantage to private insurers with massive marketing budgets to lure people away from Medicare's better policies into restrictive advantage plans. Remember, as I will show you, you have to fight past the hurdles and lies to get the Medigap supplemental insurance coverage that eliminates all your worries about unexpected or excessive medical provider bills and is on your side against outrageously priced medical services. Medicare site seems to have more deception on it around the sign-up periods in the fall. The best way to do this is to get Medigap Plan G, which protects you against excess charges that some providers who do not accept Medicare assignment, that's a technical term, if they don't accept Medicare assignment, will try to gouge you with. If not in Plan G, always ask if your medical provider accepts assignment of Medicare charges. Note those key words. And avoid those who do not do so to avoid getting billed for charges in excess of Medicare-approved amounts. Plan G and Plan F high deductible protect you from this altogether. The best medical insurance in the planet and at the most reasonable price is a combination of traditional Medicare Parts A and B plus Medigap, also called a supplemental plan, Medigap Plan G or N, combined with an inexpensive Part D drug plan. Although GoodRx can often get you the best drug prices, traditional Medicare is the most widely accepted medical insurance in the country, and it is the most efficient, providing approvals for urgent procedures almost immediately instead of the weeks of delay of other insurance plans. With the Plan G, you know exactly what your total annual medical costs will be, regardless of whether cancer, diabetes, accidents, or whatever strike. And you have complete control over what physician or medical facilities you use for treatment instead of having to be stuck in a narrow medical network of an Advantage plan. Please note, if you do not select a Medigap Plan G or N when you first sign up for Medicare, you'll have to be underwritten and could wind up paying higher premiums or being rejected if you want to get a Plan G or N but develop a significant medical condition under an Advantage plan. That's why it is important to sign up for these plans while you're still healthy. As you proceed, beware that even the Medicare site, pop-ups, and tools will sometimes try to deceive you about what a Medigap Plan G or N will cost and even their availability in your area. Ignore the pop-ups claiming to help you compare plans and persevere to get the stellar Plan G or N. Avoid the numerous traps that try to funnel you into Advantage plans. So start your enrollment in Medicare by going to the Medicare.gov site. If you're not already done so, you will want to first enroll in traditional Medicare Parts A for hospital costs and Part B for doctor visits and procedures. Part A is free and Part B costs around $145 a month, reduced by possible subsidies, but higher if your annual income is above $85,000 a year. These two plans cover 80% of the respective medical costs, and they negotiate rates from medical providers that are 50 to 70% cheaper than private insurers. So then you need to get a Medigap plan, also called supplemental plan, to cover the remaining 20% of costs. Remember that the purpose of insurance is to eliminate future financial risk. And we all know that our bodies deteriorate as we age, so it is smart to get a great plan before disaster strikes. Again, if you wait to get a supplemental plan until you have serious medical conditions, you could have to be underwritten and could be subject to higher premiums or rejected as a result. Don't risk it. Yeah. Also, petition your congressman to open Medigap plans to those who were fooled by the deceptive information on the Medicare website and related pop-ups since the spring of 2018. Okay, let's take a look at the Medicare site, and I'll walk you through what you should be doing in signing up for a Medigap plan. I'm going to swing my camera around here to shut off this. And okay, here we go. And I want to. So here's the Medicare.gov site, and you'll see a top navigation bar. And when you're looking for a Medigap plan, you want to go to the bar that's labeled, it says Supplements and Other Insurance. It's right here. And when you mouse over that, you get a drop-down menu. And the first thing you want to do is scroll down here to this line here. It says How to Compare Medigap Policies. So click on that, and that will take you to a page. Basically says how to compare Medigap policies. And you can read most of this stuff yourself. I don't need to walk you through it. But what I want you to do is focus on is when you're comparing plans, go down to the bottom, because there's a very good, why this thing is not going quite right. But anyway, there's a great table at the bottom, and it shows the various plans. They're labeled A, B, C, etc. I don't know where they come up with those letters and stuff like that. But let's scroll down here again. But some of the things a couple of things I want you to focus on. Down here at the bottom is you'll see this item here. It says Part B excess charge. That's something I mentioned before. If you mouse over the excess charge, there's a little explanation there. But as I say, that's excess charges are for those who do not accept Medicare assignment. If they don't accept the assignment, they'll try and bill you for amounts more than what Medicare approves. And the only plans that protect you from that are F high deductible and Plan G. So that's why I highly recommend Plan G. Also, they were saying that you didn't have foreign coverage. You've got 80% of the cost covered up to some amount. I think it's $50,000 here. So you got great foreign travel coverage here. Out-of-pocket limits. They were talking about that. And it doesn't even apply. You don't have out-of-pocket limits because you're not paying anything other than the premiums in most cases. So those are a couple things to check out. So you can look at this table and scroll through it and see if you find a policy that you like. And then you'll want to go back up to the top and go to the same button, Supplements and Other Insurance. Mouse over it, and then you'll come down here and it says Find a Medigap Policy. So click on that. And that will take you, put this away, so to a page. Well, when you click on that, it'll find a Medigap policy. Okay, so you click here and it says enter zip code and select location to start. Now, by the way, the Medicare policy, Medigap policies are only specific to states, so they have nothing to do with your county. They just are state specific. So, okay, it says enter your zip code. I'm in 80209, which is Denver, Colorado. I hit that, hit enter. Oh my gosh, what's it say? It says error. I got an error. Select a county. Oh, I put in my right zip code. Well, what? A county is not even necessary to select a Medigap policy. As I say, they're specific to the states. But anyway, what you see down here is below here, it displays Denver. Denver is both a city and a county. So what you have to do is click on that, and then you click on continue. This is a little thing, little trick they try to keep you from getting into the information you need, but there have been worse ones on this site before. Okay, so anyway, here you have a table that you can scroll down and see the various Medigap policies. You scroll down here, and we'll take a look up over here. It says sort policies by, and it says monthly premium high to low, and you can change that to low, high to. It goes from low to high right now. You can change it to high to low, etc. But that's a good way to look at it. Over here it says showing 12 Medigap options for people 65 and older. If you're under 65 and for some reason you qualify for Medicare, you click on the lower line here, and you get a different presentation. But for most people, leave that as it is. Okay, so you can see these policies. To the left, you'll see a range of premiums, monthly premiums, and a little summary of what's going on here. It says here that Plan F high deductible will no longer be available after January 1, 2020. I'm not sure why they wiped out that plan. It was a good plan. But anyway, in looking at these things, you'll see a little summary to the right here. But the two things you'll want to look at is it says plan details. There's a button here, and then see companies. So generally what you want to do is from that table before, you've got an idea of which plans you want to look at. When you go look at those plans, you'll want to scroll down and see the details about them. So let's scroll down, because I highly recommend Plan G. There's Plan N. It's a lower monthly premiums, but you pay copays. I think $25 copays that are not there in Plan G. So let's go down to Plan G. Here's Plan G. As you can see, the monthly premiums are $113 to $200 a month, and those premiums are in addition to your Part B premiums of about $144.60 a month. You can see that right there. So, okay, as you can see, there's only $198 annual deductible and no copays, zero. You see. Okay, so when you're interested in these things, you want to look at the plan details. But once you get the details and you kind of decide on a plan, you'll want to go to the See Companies, and you click on that button, and you'll get companies offering the specific plan in your area. Not sure why I got Plan N. Let me go back over here. G. Okay, let's do Plan G. Okay, and so you go down here. It says Show More Companies. If you want to see more companies, you can. But so let's say you pick a company that you're interested in getting a price from. So all these policies, like all Plan Gs, are all the same. All the companies have to offer the same benefits, but they have different premiums. So some of them charge a lot more for the same services. So you want to call them up and get a price for them. So there's a phone number, etc. You can call different ones, and you want to check them out with ambest.com to make sure that they've got a good financial rating and are going to be around for a while. And then also you can check out with your state regulatory insurance regulatory office to see if they've got a lot of complaints. I hardly ever have any interaction with my Medigap plan administrators. They just pay the 80%, the 20% that they're supposed to, and I don't really hardly ever hear from them. But anyway, since all these plans are the same, some charge a lot more for them. So as long as they're in good financial shape and they don't have a lot of customer complaints, go for the lower price. Now, there's no reason to pay more for an identical plan. So let's go back to the plan results, and we'll go down here to Plan G, and we'll talk a little bit about the deceptions on this site. So let's go to Plan G, and let's see plan details. Okay, so you can see you've got your monthly premium. Talks about the deductible is only $198 a year, fabulous deal, and no copays. But the thing you want to look at is, it says, okay, what is this thing going to cost, do you think? I mean, you can call provider, the individual insurance companies, and get quotes on those, but this is supposed to be an estimate of your total yearly estimated cost, premiums plus out-of-pocket costs for someone in good health. Well, you can change your health status here. It says someone in good health would pay $7,800.50 a year for that. That's totally ridiculous. Like I say, even with all my cancer surgeries and back surgeries, my total expenses have been around $4,000 to $4,500 a year. So they distorted this number. So you got to totally ignore this number, and I'll show you how they get to it. You can change your health status by clicking here, and you can see it says good health care. I've got, I'm in remission from bone cancer, but so I usually say poor health status. That would mean that's the maximum you would probably ever pay. So change the health status, And you say, oh, it says I'm going to pay $13,660 a year. That's a total fraudulent number. I've never paid any more than about $4,000 to $4,500 for everything, including my Part D drug plan, my drugs, and everything. So this is one of the lies on this site. But we'll go down and see how they come up with this thing. And that's why I say that you should expect to pay a third, a quarter of what they're showing here. All right, let's go down there. But they have to push that number high to make it look like it's more expensive than Advantage plans. But like I say, from what I can tell, the Advantage plans cost about $3,000 a year more than what I'm paying. Okay, so here you can see these are the benefits. It shows what you pay. Hospital, various terms for the first 60 days. You pay nothing, etc. It's a great plan. This is Plan G. Going down here and looking at the benefits, one of the things I mentioned was excess charges above Medicare approved amounts. What am I liable for? Nothing. I pay nothing for that. Tests and diagnostic services. With cancer, you have a ton of those. And if you had copays, you'd be paying out the rear. I pay nothing for those. Foreign travel emergency insurance. The first $250 is deductible, and then you pay 20% of a lifetime maximum of $50,000. So it's great coverage. Routine checkups and screening tests, zero. Okay. All right, so let's go down a little further here and see how they come up with that ridiculous number that they're saying it's going to cost you per year. Okay, this column here, this second column is its monthly cost, and then down at the bottom here, this is supposedly your annual cost. So here's your monthly premium for Part B. This would be your monthly premium for your Medigap Plan G. Here's a thing that says inpatient care, $35 a month. I've never paid anything like that. Like I say, I paid $40 for an eye exam. That's it. Most years I pay none of that. But the trick is they say, oh, prescription drugs. You're going to pay $806 a month. My total annual payments for drugs runs about $450 a year. And they're claiming it's $806 a month. That's how they distort the cost here. Dental services, $15 a month. Maybe that's okay. I pay a couple $100 a year for my teeth cleaning and things like that. Other services, I've never paid anything like that. So that's unlikely to be there. Total monthly estimated cost. So they're saying it's going to cost you around $1,138 a month. And that's a gross exaggeration. That's 3 to 4 times what you would expect to pay. The $13,000 really should be closer to $4,000, $4,500 now that I'm been with the plan for 9 years. So this is fraud, and this has pushed people into buying Advantage plans. And you should talk to your congressman about this lies on this site. It's terrible. Okay, that's everything I've got there, I believe. And so I'm going to switch back over here. And okay. So once you've signed up for Medicare Parts A and B and got your Medigap plan, and your medical worries should now be over, except that you should probably sign up for a reasonably priced Part D drug plan. It should cost you around $20 to $30 a month. The Medicare site is eager to guide you into a drug plan. Follow the prompts from the box labeled Drug Coverage Part D at the top of the Medicare.gov homepage. Please note that I found the GoodRx at $35 a year, and their coupons can cut your drug costs in some cases to 20% of what a Part D drug plan gets you. And that's another reason why you should demand that Congress empower Medicare to negotiate prescription drug prices. One thing I wanted to mention is that Medicare does negotiate the prices of any drugs you receive at a provider's office. For instance, like my chemotherapy drugs are all covered by Medicare, and they negotiate those prices way down. So I don't pay anything, but Medicare pays a lot more than what they're billed. For instance, like one of my infusions was $15,000 per infusion. I was getting those weekly for a while, and Medicare negotiated them down to $5,900. I paid nothing. but that's great to know that they're not getting gouged. Note that the 2003 Republican Congress passed a bill authorizing Part D drug plans and Part D Medicare. They guaranteed the pharmaceutical industry giant profits by prohibiting Medicare from negotiating prescription drug prices directly, as Medicaid and the Veterans Administration do, and they get prices that are 30 to 50% lower than the Part D drug plans you and I have to put up with. So with Part D plans, you will be paying 35 to 50% more than you should for drugs, but still substantially less than going without a plan, though GoodRx can often get you access to much lower prices. Petition your congressperson to let Medicare negotiate prescription drug prices directly and offer the Part D insurance directly rather than through money-grubbing private insurers. Medicare does cover and negotiate the price of drugs administered by a provider, as I mentioned. Please note, most of the Medigap insurers will periodically barrage you with offers for additional insurance like cancer insurance, etc. You do not need any more insurance in most cases, so ignore all this marketing baloney. You're completely covered by Medicare plus a Medigap plan and a Part D plan. Sometimes the Medicare site acts funny and will tell you there are no companies offering Medigap Plan G or N in your area. If so, reverse your browser back a couple times to the previous page and search again to hopefully get to the table of Medigap plans. Sometimes you encounter pop-ups that want to guide you through the process. Avoid these pop-ups. They're trying to get you into an Advantage plan or get you confused with a drug plan before you nail down your Plan G or N. If you really get frustrated with the site, you may be able to get help from the Medicare office in your area, but I found them difficult to contact. Don't let them talk you into another plan unless it's a Plan N, which just requires co-pays for doctor visits in exchange for lower monthly premiums. It does not protect you from excess charges, however. Alternatively, you may be able to find companies offering Medigap Plan G through your state Department of Health and Regulatory Affairs. When the Medicare site told me there were no companies offering a Plan G in my zip code, I went to the website for the Colorado Department of Regulatory Agencies. Most likely this list includes companies that offer Medigap Plan G in your area. Use this as a last resort if your Medicare.gov or the state sites mislead you. When I went to that site, the state site, there were over 20 companies offering the plan. So once again, these Medicare trustees and the administrator are trying to drive you into Advantage plans. Fraud, as I see it. As I've said, the private insurers who offer Medigap plans have to offer standardized plans and have Medicare approve their rates, which vary widely, so get quotes from multiple insurers. Don't overpay and pick one with good reputation. But they are really just overpaid paying agents for a portion of your Medicare covered costs. They just pay the last portion of medical bills that Medicare tells them to pay, while Medicare negotiates all the rates and approves all the charges and payment amounts. We would all save money on Medigap plans if Medicare demoted these middlemen and offered those plans directly by reducing the private insurers to contract payment processors, which is what they really are. Call your congressperson to demand that change as well. Finally, ask your congressperson why Congress is giving Advantage plans more money per person than traditional Medicare and driving up plan costs. Don't expect any help from AARP. They are on the take from private insurers and to promote Advantage plans. That's all I've got. Good luck and thanks for viewing.